She's not used to that. Do, 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 do. Let's have her hang upside down.
Since 2017, because it just feels good. It really feels good for my back. It really helps relieve the back pain, especially the lower back pain.
How's the pregnancy pillow treating you? Good. Makes it a lot easier to lay in your stomach when you're pregnant, right?
Yes.
Congratulations on your baby girl.
Thank you.
That's awesome. Again, as you go through the different trimesters, it's important as we adjust your pelvis and keep your hips from rotating that we don't overly rotate your pelvis when we're adjusting you on your side. We want to keep your spine as neutral as possible and helping to keep the ligaments as balanced as much as possible. Yeah. So what we want to do is when we keep your spine more neutral like this, it's good to kind of like rock your body up in the pelvis and the shoulder at the same time, rather than just rotating like this. I once had a lady who was pregnant. She asked me, is it okay to adjust her neck now that she's pregnant? And the answer is absolutely yes. If anything, that's one of the best places to get adjusted because it's closest to your brain and that's what's help regulates everything. So, how you feel?
Good.
Cool. Nice job.
Yeah. Thank you.
In the first trimester, women typically use a smaller pillow because they're starting to feel the pressure now in the abdominal area from their baby getting larger. So as they're laying face down, they lay like this, and they usually love this because not only is it a position they can't lay on their own, also allows for us to be able to adjust lower regions of their spine. As they progress out of those first 3 months into the second trimester, then we upgrade to this thicker pillow where you're going to see a little bit more cushion so they can still lay like that. And then as they enter their third trimester, we're going to actually stack these pillows one on top of each other, and this helps them to get through their entire pregnancy, maintain their hip alignment, and they can get adjusted throughout that pregnancy. When we're adjusting a pregnant patient, it's very important, whether it's before the birth or after the birth, that we really focus on their hips. We're going to be producing new hormones during the pregnancy, especially relaxin, which is going to be stretching out the round ligaments around the pelvis, which is going to allow for the pelvis to expand and open up for the delivery of the baby. But on top of that, it can cause for the pelvis to shift. One of the most important things I share with my patients is that this is called your pelvic inlet right here, where the head of the baby is going to be coming through in a vaginal birth. We want to make sure that the pelvis is actually well adjusted so we can keep the specific space in its most neutral position. When we see a lot of rotation in the hips like this, it can actually distort that pelvic inlet and make for complications during birth, where a chiropractic can actually help with keeping that realigned, make it for a healthier and easier delivery overall. That's one of the most important things. So during my wife's pregnancy, she had 3 kids. She had 1 child. Our first son was about 10 pounds when he was delivered vaginally, all naturally as well. And then our second daughters were actually twins that were 7 pounds apiece. My wife actually developed a dysfunction of her pubic symphysis. Pubic symphysis dysfunction can happen in 1 out of 50 females during pregnancy, where this front part of your pubic bone can actually misalign with this other half. And that can actually cause for excruciating pressure in that pelvic region, make it harder for walking. And in this video, I'm going to show you how we can work on adjusting and realigning that. Okay, so we're going to start by just having her abducting her legs and just warming up a lot of the surrounding muscles and tissues. So she's going to push into my hands like this for 10 seconds. And then we're going to relax. And then we're going to do it again. And we're going to relax. We typically do this 3 times. And this can be a little painful if you suffer from this. It'll be a little bit harder, okay? And then now I'm going to take my hand, make it a fist, and she's going to come and squeeze this. So we call this hip adduction, bringing the legs together, rather than abduction is taking away. We're going to do this 1 time for 10 seconds, okay? And this last one, sometimes you'll get a release with that right there, in that pelvic inlet area. But now she's going to do this on this last one, and we're going to give it a little quick thrust right here as she's pushing in. Okay, 1 time. Okay. And that will typically release that area and help out with the dysfunction. Another reason why it's so important to get adjusted during pregnancy is especially even if you're not planning on having a vaginal birth and you're having a cesarean. The thing is, if your hips are misaligned, it's going to actually change the way that you're carrying the baby. It could cause the baby to actually be putting more pressure on one nerve and more on the back side of your spine, more pressure on the left or right side of your body, and that could be causing impingements on the sciatic nerve. And even after the baby is delivered, whether it's vaginally or C-section, what can happen is that after you're producing those hormones in 6 months, those hips can get stuck that way. This could actually cause for later complications in later pregnancies, or also cause for lifetime problems of sciatica that was actually due to that pregnancy in the first place. A hot tip about pregnancy I talk to my patients about is that 2 weeks after the baby's delivered, we always love to get them to come into our clinic, take some x-rays to see how their pelvis has now shifted throughout that pregnancy. And those hormones that you produced at the beginning and throughout your pregnancy actually work for you up to 6 months. We actually call these superhuman hormones for females, so we can actually get great correction of the spine by actually using the relaxin hormone for moving and correcting their spine at a faster pace than a normal individual if they would come in, anytime after the 2 weeks after their pregnancy up to 6 months. I don't know what. Oh my goodness. Oh my goodness. A couple things. We're just gonna hold her upside down, just because we're gonna check it for any subluxations in her neck. We're gonna see if she's turning her head one way or another. And also, it's actually good for babies because it'll help decompress her spine. Then we'll put her on you and get her checked out, okay? So we're gonna slowly just grab her from her legs. And this is something you can do at home too. Just have her hang upside down. So what we're trying to see, and we're not gonna do this for too long, is to see if she turns her head to one side more than the other, because that can indicate a subluxation on the upper cervical to that side. Usually babies like this, maybe not right after they ate, but. So what I want you to do is lay on your back, Carla. Oh my goodness, I forgot how tiny they come. She's got so much hair.
She has a lot of hair.
Okay, you're gonna have her lay on her stomach, on top of you. Okay, so we're just checking a little pelvis alignment. Okay, so we're gonna do a little light impulse in our little SI joint. We're using our activator tool. But just so you know, I'm on a really, really low setting. She's not used to that. She's a little tight in that lumbar area. She's pooping okay?
Yeah.
Oh, good. A little reaction there. Good. All right, we got a little guy right here. Yep, she's okay with that one. Now she's starting to get used to it. Okay, I'm just gonna kind of slightly stretch her out a little bit. Slight traction and activator. That's all we do. I know, welcome. She's like, that's not the way I wanted to wake up today. She's like, most of my life I was just waking up naturally, but today I woke up differently. All right, well, let's have you kind of sit up here. What I want to do just next is just kind of stretch out her legs a little bit. So I'm just keeping my fingers on her sacrum and just kind of stretching out a little bit. You know, when you're in the womb, the fetal position, everything gets bound up, so. I like traction. Okay, perfect. That's all we do for day one. She's like, I didn't even wake up. That was so easy, so simple. You want to see this look of satisfaction on her face? I'm satisfied. I'm ready to go back to bed, Mama. But she's looking great. Yeah. No different than anything else. You know, any other baby. You know, there's definitely going to be little misalignments here and there. And we can check her out next week again.
Okay.
Sound good? Perfect.
Back in bed.
Babies are people too.